The Chicago Classification version 4.0 was published in 2021, accompanied by 7 technical review articles. Introduced in these publications is a new protocol for acquiring esophageal manometry studies. The Versatech Healthcare CView 3.4 was developed compatible with Chicago 4. The software includes features for the acquisition and analysis of the swallow types included in the new publications. The ZView protocol is flexible, allowing for moving through the steps in a customized fashion. This video will briefly review the Chicago protocol steps and showcase how ZView simplifies the acquisition of an esophageal manometry study. The protocol from Chicago 4 lists supine swallows being given first, upright swallows second. Though this swallow order can be reversed, studies usually end with the upright and rapid drink swallows to mitigate aspiration risk in patients with a full esophagus. Whichever position, supine or upright, is acquired first is called the primary position, and the opposite position called secondary. A quote from the main article. Classification is based on the primary position in which 10 wet swallows are performed, either supine or upright. Assessment of the swallows in the secondary position and with provocation provide supportive data. Chicago 4 recommends doing all steps on every patient for research consistency. They do concede that clinical facilities may choose to customize their protocol to meet their needs or the tolerance of their patients. Either way, the ZView acquisition features allow for easy customization. In ZView, once a new patient has been set up, a workflow can be selected to give instructions for selected swallow types. Starting with ZView 3.40, there is a new comprehensive protocol that includes instructions for swallow types referred to in Chicago 4. After entering the patient demographics, click on the drop-down arrow next to the Workflow field and select Add Workflow. In the Workflow wizard, select the esophageal study type, the insight system used, the probe model, and your calibration method of choice. Choose the comprehensive protocol to give the instructions and buttons for swallow types mentioned in the Chicago 4 publications. Select your preferred report type and end. If you choose to, you can rename the workflow. Click Save. Now this workflow can be selected from the drop-down menu for future studies. Here's a demonstration of acquisition of the different swallow types, showcasing how the protocol steps on the left have been organized to allow for moving through the different swallows. On the initial page, you'll notice that there are buttons for deep breath, pharmacological provocation, and lateral position. The provocation and the lateral position do not affect the analysis, but they will be noted on the report. Once the probe is placed, the patient is given a minimum of a 60-second adaptation period, which is the equivalent of the screen scrolling entirely from right to left. Then instruct the patient to perform 3 or more deep breaths to confirm probe placement through the diaphragm. Move to the step to adjust the probe bar for the UES, the LES, the EGJ, and the diamonds. Then move ahead to the protocol steps. The supine resting measurement is often the first measurement acquired within the study, but it is no longer required to be the first measurement. Should you choose, you can skip ahead in the protocol to other steps, such as upright measurements. But in this case, we will begin with the supine resting. The supine resting is now acquired during a 30-second period, which is a half of the screen. There is a timer in the upper right-hand corner to guide you. If at any time the patient complains of symptoms such as chest pain or cough or gag, it can be noted with a button push. The comment button can also be used for custom symptoms. Once you are into the swallow section, you also have a button to mark if the patient complains of dysphagia. Once the resting measurement auto times out, it will automatically move forward to the liquid swallow step. In this case, we're going to add a custom symptom by clicking the comment button, typing in the symptom, and pressing the blue plus sign. Now, if the comment button is pressed again, we can find that same symptom under the drop-down arrow. It'll be available for selection for future studies. Click the liquid swallow button and administer the swallow per the instructions. Note that in the upper left-hand corner of the instructions, it tells which swallow types are required for pattern classifications in Chicago 3 and separately for Chicago 4. Once all liquid swallows have been acquired, click the viscous button to be given steps for acquiring viscous swallows. Although not officially a part of Chicago 4, they are mentioned alongside solid swallows, as both are a greater challenge to the esophagus. Once all desired viscous swallows are acquired, click Multi-Rapid and begin the multi-rapid measurement. With Chicago 4, it is recommended to get 1, 2, or 3 sets of multi-rapid swallows. If the after contraction with the first multi-rapid set is adequately strongly peristaltic, then no further sets need to be acquired. But if the first multi-rapid set does not yield a good peristaltic after contraction, then do a second set. If that still isn't adequate, do a third set. Once all supine swallows have been acquired, there'll be a step for an optional supine resting. If the initial resting was adequate, you may choose to skip this step. Moving on now to the upright position, the patient is seated upright with the feet over the side of the bed, head up 80 to 90 degrees, not hunched over. They're given another 60-second accommodation period, and 3 deep breaths are required to help document the sphincter position in case there's been any probe movement. This is followed by an upright resting measurement, which is again acquired over a 30-second time period. Once 30 seconds is done, the measurement will auto-complete and the software will skip ahead to the upright swallows. These swallows are considered the secondary position if 10 liquid swallows were acquired. Click the upright button to initiate an upright swallow measurement. Although bolus transit is not part of the upright measurements, you may still choose to use saline to be able to observe bolus movement, but if you choose, you can also switch to water, either tap water or bottled water at room temperature. Once all desired upright swallows have been acquired, you can move on to the rapid drink challenge, which is 200 mL of water consumed through a straw from a cup as fast as they can. The patient is given 30 seconds to complete the maneuver. At the end of 30 seconds, if any fluid is remaining, that can be measured and noted. Remaining fluid is considered symptomatic. This measurement can be accepted when the first UES opening reaches the green mid-screen line, that is 30 seconds. Or it will auto time out at 50 seconds, which allows for any after contraction to be included in the measurement. Generally, only 1 set of 200 ml rapid drink is acquired because it fills up the patient. Solid swallows and solid meal swallows are not frequently ordered, but the instructions for acquiring these measurements will be discussed here. You can click on the solid button and administer solid swallows. These may include boiled rice, dumplings, bread, meat. Anything that might be an offending agent for the patient can be given. It is recommended to have 5, but better to have 10 swallows of a solid material. Solid swallows may be acquired if the viscous step was skipped. This is a good way to give a challenge to the esophagus and possibly elicit symptoms. When it comes to solid swallows, if the patient double swallows within 4 seconds, this can be counted as a single swallow effort. Once all solid swallows have been acquired, a solid meal may be administered. This is 200 grams of something like oatmeal or, again, bread, meat, a sandwich. We don't mark the swallows as they go because it's difficult. We do mark the start of the meal and any symptoms. They have 8 minutes to consume a 200-gram meal, and they will eat upright in an uncontrolled manner like they might at home. You can turn on the bolus transit so you can see how much the patient may be filling up or having difficulty clearing the bolus. If they are unable to complete the 200-gram meal within 8 minutes, then the comment button can be clicked and there is an annotation to note that they were unable to finish. Once they are done with the meal or the 8 minutes has expired, click the End Meal button. Measurements may be created during study analysis. In the next step, you may acquire a second upright resting measurement. If the original upright resting measurement was adequate, you may choose to skip this step. UES swallows are not part of Chicago 4, but may be desired data. The probe can be adjusted to show more pharynx above the UES prior to beginning. There are buttons for acquiring a UES resting measurement and 3 to 5 quick UES swallows. If at any time you want to move back and repeat a step, that is an option. Once the probe is pulled, the compensation line is clicked and applied to the study. This ends the acquisition of all swallow types recommended in Chicago 4.